Today, we'll hear from people with unique insights into the systemic problems that limit access to holistic care. The fragmentation of medical and psychiatric services affects everyone, but it is especially damaging for people with profound medical complexities who also have mental health care needs. You'll hear more today from these patients and those caring for them who often have to choose between treatment for their minds or their bodies. But we believe change is possible, and it starts with the kinds of conversations that we'll be having today. Without further ado, our first speaker, David Ambrose, is intimately familiar with the challenges faced by vulnerable populations. Eventually, he was able to escape the cycle of poverty that traps generations of families. I could not think of a better person to inspire us to know that not only is change just possible, it's necessary.
Good morning. Wow. I guess I'm the opener. I was 12 when I went into foster care for the final time, having survived starvation and near death at the hands of my mother. The pressure that forged the person that's talking to you, even though I'm afraid of crowds, should not be created. There are very many moments when I could have gone the other way. We can end the pipeline of poverty if we invest in the system, if we invest in the families. Once a month, we're going to read the paper together. We're going to go to a meeting. We're going to volunteer. We're going to inculcate the values that you live into the next generation.
My lens is as a pediatric psychologist within medicine, so I'm going to talk a lot about our medical system. We are finally at a point in history where we're recognizing that mental health is health.
It's my pleasure and honor to sit with such esteemed professionals in this space, and so I want to thank Nexus for holding space for this conversation. I want to thank all of you all for being here.
When you actually take the time and you sit down and you listen to what are the families really struggling with, that's when you get a sense of, oh, these are issues that are really impactful to them.
Treat these complex kids, you just have to treat it from the psychiatric standpoint is not just, it goes beyond the mind, it's the body, the whole person.
Also, I think when we're talking about this and we're talking about holistic care of the patient, sometimes the exhaustion that the parents face, and sometimes they're bringing us into hospital just for some respite. So how do we make a change in that family's life to kind of change their future?
A group of mothers who came together and said, the system is failing my adult children with serious mental health conditions. We provide education programs to a variety of audiences, primarily family members and individuals with mental health conditions, with an increasing focus on young people.
So at each table, you have one book bag. Anything that can bring an uplifting message to one of these youth who are going to get the book bag, go ahead and write that down. Today, I feel like holistic has been a word that's been talked about, so treating the whole entire person, not just a medical disability, but mental health. Everything that makes a person, that's our holistic approach.